our chief guest for today, Dr. Mohan Kameswaran. Unfortunately, Ms. Karunanidhi could not come because she is in this post and not feeling well. She sent her best wishes and assured to visit the center very soon too. So we actually wish her fast recovery, and I'm sure she'll come and visit and bless the occasion and all the facility very soon. And we are very fortunate to have Dr. Mohan Kameswaran. I don't think he needs any introduction to the people of Chennai. And if anybody, in fact, if Tamil Nadu or Chennai is in the forefront of ENT only because of him. And he comes from an illustrious family of Dr. Kameswaran and Dr. Lalita Kameswaran, both of them, and he is taking their legacy 100 times forward. In now becoming one of the most well-known ENT surgeons the country has ever produced, a Padma Shri, and also a person who feels very connected to the society. Apart from all of us, in one day or other, has to be his patient. And for me, I know my incident, 1 month I would not talk because of him. So my family was happy, my people were happy, everybody in the company was happy because I could shut my mouth for 1 month. And he has done that for almost every VIP in the country, and he is known as a person who actually every doctor wants to emulate his example for humbleness and the society, what he has been carrying forward, the legacy of his parents. And we are very, very fortunate to have Mrs. Indira Kameswaran. So for every man, for success, there has to be a woman behind. For Professor Kameswaran, it is actually Mrs. Indira Kameswaran who has been in the front and back, both. So for her, anything we want to talk to him, we only talk to her first. And she is also a fellow member in our FICCI Flow, and we are a socialite and doing a lot of social services, and we are very fortunate to have her today. So both of them, though Mrs. Kanimozhi could not make it today, I think unfortunate to have these two very eminent dignitaries today being part of this function. This function is all about, I think, some time back when Mr. Udayanithi opened this facility, our reference laboratory was opened by him. That time we assured, saying within 6 months we will be able to upgrade this facility to bring all the radiology modalities to make it integrated diagnostics. This is the only facility currently which houses the entire top-end pathology, one of the largest reference pathology in India here, and also a genomic setup, metabolomic setup, radiology including CT, MRI, fetal medicine, everything here. And here we have with me my colleague and joint managing director of Neuberg Diagnostics, coming all the way from Ahmedabad, and he's a very, very well-known pathologist, and he's been the rock solid behind the growth of Neuberg over the past 7 years, from being almost a startup to become one of the top 3 diagnostic company of Indian origin in just a matter of 7 years. So I'm fortunate to have partners like Dr. Sandeep and others with me. And we have Dr. Babaharan, who is just a new addition to our family. He runs one of the most reputed radiology practice in Trichy called Magnum Diagnostics, and he is known as one of the very well-known faces for fetal medicine. And he will be now manning and also leading this venture, our radiology venture across Tamil Nadu, starting from here. And we have a full-fledged CT and MRI center, very advanced CT and MRI, and also we are just launching today by Dr. Professor Mohan Kameswaran, the Center of Excellence for Fetal Medicine, to actually take care of the pregnant women in different situations, and we are just inaugurating that center too. And apart from that, he is a full-fledged radiologist reporting all modalities, though his passion is in the area of fetal medicine. Apart from that, we have many people, and particularly I would like to say Dr. Maharashma, who is considered another Padma Shri, coming all the way from Delhi. What is going on is the entry of Neuberg into radiology in Tamil Nadu. Thank you so much, Doctor, for being here. And along with him, we have Mrs. Riku Mahajan and Mr. Kabir Mahajan is also here. So to have somebody of that reputation of Mahajan imaging being present here is a great blessing and support for us. So we also would like to thank all of you for having come and bless this occasion, and we look forward to your support moving forward. Thank you.
Diagnostics, we have, let's say, you have pathology, you have radiology, multiple modalities are there, but everything stands alone. And for a patient who walks in with a problem, every modality gives its own diagnosis. Now, we don't want that. We want everything to be integrated under one roof. And by far, I could say it's a comprehensive approach in healthcare, where multiple diagnostic tests are evaluated, combined to give a better patient healthcare outcome and management. That is what is about integrated diagnostics is all about. So what we are planning in Neuberg is a complete, comprehensive and holistic approach to any diagnostic and treatment modality. So how are we different from other scan centers or other labs that's available across India is that we have all modalities. For example, radiology, you have cardiac CT, you've got the high definition MRI, you've got the fetal medicine unit, and also we are integrating this with a high-end laboratory which is in the first floor, starting from all basic tests to high-level genomics and molecular diagnostics. So everything integrated. I would say this is the only facility across India which could have from basic to the top-notch investigation that is available. Now a patient walks in, we give him a solution, not from only basic blood tests, but also up to the molecular level. Now this is integrated with the artificial intelligence and also the patient data flow management. So a patient walks in, will have the entire data of his entire history, whatever he has. According to the problem, he can be managed to his needs. So that is what this integrated diagnostics is all about. So in Neuberg, we've got the state-of-the-art radiology, we've got state-of-the-art pathology, biochemistry, microbiology, genomics, and the molecular biology medicine. Everything integrated. Now, you can tell across from Chennai to Ahmedabad now, there's just one flight away and we are connected. So any test, patient walks in and the entire test will be done here. There will be no questions asked whether this test is being done in Neuberg or not anymore. Every possible test is available. And also we have introduced a fetal medicine unit here, which is again an integrated unit, where we will diagnose problems for the fetuses, which is in the mother's womb, and also treat these fetuses. For example, ஒரு குழந்தைக்கு வயிற்றில் இருக்கும்போது ஒரு ப்ராப்ளம் இருக்கு அப்படின்னா எல்லா ப்ராப்ளமும் இல்லை 100 ப்ராப்ளம்ல 10 ப்ராப்ளமும் நம்மளால வயிற்றுல ட்ரீட் பண்ண முடியும் கண்டுபிடிக்க முடியும். அதுக்கு there is something called as fetal surgeries, and all this will be brought in very shortly, and we've already got the fetal medicine unit, and up to the fetal interventions we'll be able to do here. And one more thing that we are planning to do here is intervention radiology, where it's called keyhole procedures. Keyhole procedures now, for example, a patient with liver, let's say there is an abscess or salam, then probably he will not require a surgery, but a small hole, put in a tube there under ultrasound or radiology guidance, and relieve his problem completely, where patient will not have any surgery, just in the procedure he will be cured in the next 4 days and he can walk home. So we plan to extend this across India in probably in a very few years. So that's our promise of integration. So, and thereby enhancing accuracy in diagnosis, facilitate the management with the help of technology, so that we pave way for a healthier future, and this future, healthier future for all the citizens will be available across India in a very short time. So thank you.
Months ago, when Mr. Udayanath Stalin opened the lab, Mr. Velu then promised that he will expand it within 6 months. He is a man of his words. He did it, I think even before that. To him, this building is very small. He needs a place, several acres, to fulfill all his visions. I wish that happens very soon, and we are part of it. Thank you, Mr. Velu, for giving me this opportunity. I would like to congratulate Mr. Shubha, my dear friend, my soulmate and my sister, and I wish her all the best and the family all the best. Thank you.
Thank you, ma'am, for your kind words.
Distinguished members of the press corps. First of all, I want to thank Dr. Velu for inviting me over, and my wife as well. It's really a memorable event, not just for him, but for all of us. I think this is a landmark event certainly for the country and certainly for the city of Chennai. Now I want to talk a little bit about the importance of this of this facility, to our, at least to our press corps, because they may not understand, but I am right in the middle of it as a clinician, as a doctor. When I started my career as a doctor nearly 50 years ago, the way we diagnosed was by clinical medicine. We felt the pulse, we felt the auscultated the chest, listened to the heart, with a stethoscope, and we diagnosed. And there were few investigations available. In fact, I was starting as a neurosurgeon, so we never had a CT scan, we never had an FMRI or an MRI. We used to have plain X-rays, and we used to inject dye into the carotid artery and take pictures. That was about the maximum investigation. And a lot of it was left for the surgeon or for the physician to diagnose, sometimes a surgeon on the table, and for the physician, to very often by trial and error. And believe me, the trials were a lot, the errors were quite a bit, and we were very often, in a situation where we lacked information. All this has now changed. The last 2 or 3 decades has become the era of evidence-based medicine. So for every diagnosis we make today, we have multiple evidences to prove that diagnosis. And what is this evidence? The evidence comes from a place like this. So this is the importance of this place. So when you say, I want evidence, I'm going to diagnose a particular condition, I need multiple evidences, not just one evidence. And evidence may be, as Mohan said, it could be in genomics, it may be coming from a field of radiology, it may be coming from the field of molecular biology, from histopathology, or biochemistry, or hematology. So multiple areas where we could be getting diagnosed, and for one disease there may be multiple evidences coming from different branches. So as it is now, what happens is, I take a patient with, say, a cancer in the throat, I take a biopsy, send him to the pathologist, and the pathologist then does histopathology, and then he may send it for molecular biological workup to another person. I may be then asking for a CT scan, and the patient goes to another center for a CT scan. And then we get, so we get multiple, the patient gets shuttled up and down, goes from pillar to post. All this is changing now with this one facility. Patient walks in here, he goes with an evidence-based diagnosis. That's really remarkable. That's the future of medicine. And Dr. Velu is very far-sighted. Fetal medicine is absolutely the future. And you've got a wonderful person, Mohan, here, who is all into it. So I can see now that this is going to be a facility for, not just for an infant, it may be from conception onwards. It goes all the way throughout your life. So it's a remarkable facility. I certainly don't know of such a facility anywhere else in India, that's for sure. In fact, to be very honest, I don't even know of such a facility anywhere outside India, to be very honest with you, because I go all over the world. I go to the US quite a lot. I travel as a visiting professor to multiple countries, to UK, to the US, to Far East, to Japan. I go to many countries. I'm not really very sure that I have seen such a facility anywhere. So, in that respect, I think you are a path breaker. You've really, done it. You've really done it. This has been, of course, an utopian dream for many people. Many people have been saying, "Oh, we need to have something like this," but you actually done it, and I think that's really you. You're a man of action. It's amazing that you've worked with it. Now, I'm a direct beneficiary of Neuberg, because in my center, all my diagnostic facilities are outsourced to Neuberg. And believe me, we have, over the years, we have become really more than friends, we become partners. I have come to rely heavily on them. Neuberg, for me, represents two things. One is precision, and the second is reliability. both are absolutely the cornerstones of Neuberg Diagnostics. So you can trust them with the diagnosis when they give you a diagnosis, and it's not only reliable, it will be absolutely precise. So you have the information. And then of course, once I have a diagnosis, I keep telling my students, my patients, once you have a disease, the diagnosis, even an idiot can treat the disease. You don't need a very clever man for that one. The cleverness comes in diagnosing the problem. So this is where, this is a great boon certainly for the whole country and absolutely for the city of Chennai. So I really compliment Dr. Velu and the whole team. I really thank them for putting up such a facility so that the people of the country and particularly people of Chennai are going to be greatly benefited. I know that this is only the hub. The spokes are all over the country and even outside the country. So I know that this is a hub and spoke model, that spokes are everywhere. So the facility is not just limited to the physical premises here, but virtually extends to many centers all across the country and very soon across the globe. So wonderful, excellent, well done, and hearty congratulations to Dr. Velu. And like you said, I agree with you. Behind every successful man is a lady who's often goading him and not trusting him enough. And because nobody says how far behind. So they all say behind every man, but nobody says how far behind. But Mrs. Velu, to me, is absolutely the person behind the success. So you only have to talk to her for 2 or 3 minutes to know where all this success comes from. She was sold of his strength and his family, of course. So I'm really happy that they have come forward with this great facility. I'm very sure it will be a great success. I have no doubt about that. But more than that, I think there's a certain amount of public service in this. It's not only about commercial interest. Obviously, commercial interest comes in it, but much more than that, more than the actual profit orientation. It's a service. It's a service to the public. So I thank him on behalf of the public also for putting up this integrated diagnostic facility. And Bhavran, I think you have really launched a wonderful idea, concept, and it is there physically for you now. So I can see that you're going to be making tremendous strides in that field of fetal medicine also. So all the best wishes. God bless you all, and wishing you many years to come. Thank you.
Thank you, Prof, for your kind words.
I'm Dr. Bavaharan, radiologist, Neuberg Diagnostics head. In the facility, integrated diagnostics in Salai, where any investigation starting from basic to the advanced levels, radiology, pathology, tissue diagnosis, blood test, genetic test, all tests one center, you can do it today at Chennai, Neuberg, and Perungudi. So in the facility, we have got radiology, we have got cardiac CT, heart scan CT, high definition MRI, where sound kammiya kekra MRI, fetal medicine, karuvil irukka kulandayoda nalan, adoda problems, and adukku வைத்திய வரிமுறைகள் எல்லாமே ஆக்சுவலி நம்ம இங்கேயே பண்ண முடியும். அது மட்டும் இல்லாமல் இங்கே ஒரு 12,000 சதுரடியில் we have got a complete lab and which has everything complete starting from basicலேருந்து advanced test வரைக்கும் எல்லாமே இங்கே பண்ண முடியும். So this is the first of its kind in entire India where we have got basic to the advanced level. All investigations, எந்த பேஷண்ட்டுக்கு என்ன need of investigation வேணாலும் இனிமேல் ஒரே சென்டர், that will be Neuberg at Perungudi, Chennai. Thank you.
Diagnostics இப்போ ஹாஸ்பிட்டல் ரெஃபர் பண்ணுவாங்க. இப்போ நீங்களே இந்த பிரச்சனை சொன்னா எடுப்பீங்க?
ரெண்டுமே சார். ஃபார் எக்ஸாம்பிள் இப்போ ஒரு ப்ரெக்னென்ட் பேஷண்ட் வராங்கன்னா டெஃபினட்டாக ஹாஸ்பிட்டல்லேருந்து ரெஃபர் பண்ணால் தான் ஜென்ரலி வி டூ த ஸ்கேன். அது பை நார்ம்ஸ், கவர்மெண்ட் நார்ம்ஸ். ரெஸ்ட் ஆஃப் த பேஷண்ட் இப்போ பேஷண்ட் ஒரு ஹெல்த் செக்கப்புக்கு வரணும், அவங்களோட ஜென்ரல் நலன் எப்படி இருக்குது, இது ரெண்டாக பிரிச்சுக்கலாம்னு வச்சுக்கோங்க. இல்னஸ், வெல்னஸ். வெல்னஸ்னால் ஒருத்தர் நல்லா இருக்குமா, நமக்கு ஏதாவது ப்ராப்ளம் இருக்கான்னு பார்க்குறது வெல்னஸ். இல்னஸ்னால் ஒரு ப்ராப்ளமோட அவருக்கு என்ன ப்ராப்ளம்னு டயக்னோஸ் பண்ணுறது. ஸோ ஒரு ஜுரம்னா ஃபஸ்ட்டு ஒரு டாக்டரை போய் காமிச்சிட்டு தான் வருவாங்க. பட் அது மட்டும் இல்லாமல் ஒரு பேஷண்ட்டுக்கு ஒரு ஒரு முட்டி வலி ரொம்ப நாளாக இருக்குது, இப்போ அவங்களுக்கு தே வாண்ட் டு நோ வாட் இஸ் ஹேப்பனிங் அப்படின்னா தென் நமக்கு எம்ஆர்ஐ பண்ணிவிட்டு அதுக்கான பிளட் டெஸ்ட் பண்ணிவிட்டு உங்களுக்கு இதுதான் ப்ராப்ளம், ஸோ யூ கேன் கோ அண்ட் மீட் தி ஆர்த்தோபெடிஷன் அப்படின்னு கூட நம்ம சொல்ல முடியும். ஸோ இது 2 வகையிலும் நடக்கும். பட் மோஸ்ட் காமன்லி ஒரு 60% ஹாஸ்பிட்டல் ரெஃபரன்சஸ், டாக்டர்ஸ் ரெஃபரன்சஸ் இருக்கும். 40% டேரெக்டாக பேஷண்ட் கேன் come and walk in, except for pregnant patient. Pregnant patient க்கு மட்டும் ஸ்கேன் எடுக்கிறதுக்கு we generally require a requisition form. அது இருந்தால் தான் generally we take it.
சார் இப்போ டேரெக்டாக வர கஸ்டமர்ஸ்க்கு வந்து இப்போ பேஷண்ட்ஸ் வந்து இப்போ இன்சூரன்ஸ் கவர் பண்ணுவீங்களா? டேரெக்டாக வரும்
இன்சூரன்ஸ் கவரேஜ் ப்ராபப்ளி இப்போ டேரக்ட் வர பேஷண்ட்ஸுக்கு வந்து இன்சூரன்ஸ் கவரேஜ் இருக்காது.
அவங்களுக்கு இருந்தால்
we can do it.
இல்லை பாசிபிள் இருக்குல்ல?
I am Dr. GSK Velu, Chairman and Managing Director of Neuberg Diagnostics. இப்போ இந்த இன்டெகிரேட்டட் டயக்னாஸ்டிக் சென்டர் வந்து இன்றைக்கி அவங்க சென்னையில் ஓப்பன் பண்ணியிருக்கோம். இதில் வந்து மெயின் அட்வான்டேஜ் என்னென்னா இது ஆல்மோஸ்ட் 60,000 ஸ்கொயர் ஃபுட் ஃபெசிலிட்டியில் எல்லா டயக்னாஸ்டிக்ஸும் வெறுமன பெத்தாலஜி ரேடியாலஜி மட்டும் இல்லாமல் ஜீனோமிக்ஸு, ஆடியோமெட்ரி, ஸ்பைரோமெட்ரி, டென்டல் செக்அப், ஐ செக்அப் எல்லாமே இங்கே பண்ணுற மாதிரி. இப்போ வருமுன் காப்போங்கிறது ஒரு இம்பார்ட்டண்ட் இனிஷியேட்டிவ் நம்ம கவர்மெண்ட்டும் பண்ணிகிட்ருக்காங்க. நாங்கள் ப்ரைவேட் செக்டரில் வந்து எங்களால் முடிஞ்சது சோஷியலி ரெஸ்பான்சிவ். ஒரு இல்னஸ் வர்றதுக்கு முன்னாடி இதை எப்படி காப்பாற்ற முடியும், அதுக்கு வந்து இல்லை எவ்ரி இயர் ஒரு தடவை வந்து ஒருத்தவங்க ஹெல்த் செக்அப் பண்ணிக்கும் போது இந்த காலத்தில் வந்து ஒரு பேசிக் ஹெல்த் செக்அப், மாஸ்டர் ஹெல்த் செக்அப்னு பண்ணிட்டு இருந்தோம். இப்போ இந்த நியூ ஏஜ் ஹெல்த் செக்அப்னு வந்திருக்கு. அதில் வந்து இதெல்லாம் இன்க்ளூட் பண்ணி இந்த ரேடியாலஜி மொடாலிட்டி, ஜீனோமிக்ஸ் மொடாலிட்டி, ஐ, டென்டல், இஎன்டி, இது எல்லாமே ஒரு வருஷத்துக்கு ஒரு தடவை செக் பண்ணுறது வந்து ரொம்ப இம்பார்ட்டன்ட். ஸோ அதுக்காக இந்த ஒரு ஃபெசிலிட்டியை ஒரு முன்மாதிரியாக இங்கே ஓப்பன் பண்ணியிருக்கோம். இதை தவிர தமிழ்நாடு முழுவதும் ஓப்பன் பண்ண போகிறோம். ஏற்கனவே வந்து நம்ம தமிழ்நாடு முழுவதும் எங்கள்கிட்ட வந்து ஒரு 200+ கலெக்ஷன் சென்டர்ஸ் இருக்குது. இந்தியா முழுவதும் மோர் தென் 2000 கலெக்ஷன் சென்டர் இருக்குது. 160+ லேப் இருக்குது. ஸோ இது இந்தியா முழுவதும் நியூபர்க் இருக்கிறது. தமிழ்நாட்டிலேருந்து வந்த கம்பெனி ஃபஸ்ட்லேருந்து இதுதான் ஃபஸ்ட் டைம் வந்து சென்னையிலேருந்து ஒரு டயக்னாஸ்டிக் சென்டர் வந்து இந்தியா அளவில் போய் ஒன் ஆஃப் த டாப் 3 டயக்னாஸ்டிக் கம்பெனியாக ஆயிருக்காங்க. அதுக்காக எங்களுக்கு வந்து இந்த தமிழ்நாடு மக்களுக்கு எங்களோட நன்றியை தெரிவிச்சுக்கிறோம். இப்போ வந்து வெறும் 7 வருஷத்தில் நியூபர்க் வந்து ஒரு பெரிய டயக்னாஸ்டிக் கம்பெனியாக ஆகிறதுக்கு காரணம் வந்து நாங்கள் பண்ணுற இந்த சோஷியலி ரெஸ்பான்சிவ் டயக்னாஸ்டிக் சர்வீசஸ். நம்ம இப்போ பெத்தாலஜின்னு பார்த்தீங்கன்னா 5000க்கு மேலே ஒரு டயக்னாஸ்டிக் பண்ணிகிட்டு இருக்கோம். இப்போ இந்த ரேடியாலஜி பார்த்தீங்கன்னா எல்லா விதமான ரேடியாலஜி சர்வீஸும் பண்ண முடியும். இப்போ ஒரே ஒரு ஃபெசிலிட்டி இந்த பெட் ஸ்கேன் மட்டும் இல்லை, அதையும் கூடிய சீக்கிரத்தில் தமிழ்நாட்டில் இங்கே கொண்டு வரப்போம். நாங்கள் அது தவிர மீது எல்லா ஃபெசிலிட்டியும் இந்த ஃபெசிலிட்டியே பண்ண முடியும். Thank you.